So first of all, this is not a simple seesaw. It's actually more like a Jenga game because of all the different pathways that are intersecting. So when I think about chronic inflammation, I'm thinking that yes, we have too much inflammation, but we also have too little resolution. And those opposing things happening simultaneously are leading to chronic inflammation. So we literally see overproduction of IL-1, IL-6, and TNF-alpha, reactive oxygen species, and leukotrienes and prostaglandins. And we see an underproduction of the lipoxins, protectins, resolvins, mucins, and Tregs. What's important about all of these is that all of them are coming from our macrophages. So it's our macrophages that tend to be misregulated in chronic inflammation, not our T cells and B cells. It's our macrophages. So what are our sources of chronic inflammation? Probably the biggest source is food hypersensitivity, inflammatory foods, and obesity. Those three things together, all related to food, strongly related to chronic inflammation. So food hypersensitivities. Often there are people who have hypersensitivities. They have Th1 reactions to food and they're not aware of them. Then there are foods that are just inflammatory. What do I mean by that? Caffeine, for some people, is inflammatory. MSG is inflammatory. There are foods that just, they have histamine in them, like some cheeses. They're inflammatory. Then there's obesity. It turns out that the adipose tissue actually can, it has macrophages in it, and it can make IL-1, IL-6, and TNF-alpha. And so just by virtue of having adipose tissue, you're going to have higher levels of IL-1, IL-6, and TNF-alpha. Stress and anxiety can lead to chronic inflammation because our HPA axis is controlling how much of the cytokines we're making. It's acting as a rheostat, turning up and down the level of cytokines. Periodontitis is one of our more common levels of chronic inflammation. A lot of people don't go to their dentist, and we've now got epidemiological data that links periodontitis and cardiovascular disease that shows that people who have gum disease are developing cardiovascular disease. Then we may have things like unresolved injury, undiagnosed infections. Those are less common. Not sleeping. It turns out sleep deprivation is a very common cause of chronic inflammation. When you sleep through the night, you have the constellation of proteins in your cells that create the inflammatory proteins. It's called an inflammasome. That resets. So if you don't sleep through the night, it never resets, and you continue to make more inflammatory cytokines. Another aspect of chronic inflammation is the underproduction of our protectins, resolvins, mucins, and lipoxins. And that has to do with our omega-6, omega-3 ratio. So our standard American diet focuses much more on omega-6s, whereas if you look at where our protectins and resolvins are, they're at the end of the omega-3 pathway. And our consumption of flax, walnuts, green leafy vegetables, fish oil is much lower. As a result, we tend to make less protectins and resolvins, and we make more of the pro-inflammatory leukotrienes and prostaglandins. So if we have people who are having trouble resolving an infection, going to an omega-3 supplement, fish oil, that sort of thing is also going to be very helpful.